If you've been watching our program for the past few months, you know this is the space where we talk about IVF, fertility, ART, and connect you with some of the best IVF specialists from across the country. Now, IVF is not a new concept anymore. It's been out there for 40 years, and it has also been popularized in pop culture with a lot of films like Mimi, Vicky Donor, to name a few. But there are still some questions that need to be answered. And that's exactly what we're getting done for you today. We've collated a list of the most commonly asked questions, questions that you've asked us through this platform, and questions that patients have asked the doctors who have visited us here. To answer these questions for you, we have today Dr. Nandita Palshetkar. She's the founder and medical director of the famous Bloom IVF Group, which has been recognized for doing great work in the field of reproductive medicine in India since the past 30 years. Dr. Nandita has also done innovative work in the field of microtesa and ICSI for non obstructive azoospermia. Thank you, Doctor, for joining us today.
Thank you. Thank you, Meghna, for having me here today. I'm really looking forward to our conversation.
So, ma'am, I think it's only fair to start with the most basic question that I'm sure you've also been asked over and over again in your practice, which is that what is IVF and how is it done?
See, IVF is basically a technology where we create the baby outside the body. So normally one egg is released from the body, from the ovary, and it comes into the fallopian tube. And if the sperms are deposited in the vagina, they go and they fertilize the egg in the fallopian tube, and the baby is formed there. It's called the embryo. Then the embryo goes into the uterus, and there it grows for 9 months. So what we do is we take this process and do it in the laboratory. So in IVF, what we do is we give the girl injections so that instead of producing one egg, she produces about 10 to 12 eggs. So these injections are taken for about 10 to 12 days of a period. And then once we know with the help of a ultrasound or a sonography that they're growing well, it's reached the proper size, then we give another injection for its maturation, and then we admit her into the hospital, and then once she gets admitted, we put her under general anesthesia, put in a needle, with looking at the ultrasound. So it's ultrasound guided needle. And like how we collect blood, that way the eggs are sucked out from the ovary. And then these eggs go into the IVF laboratory. And in the laboratory, what happens is the embryologist takes these eggs and then they fertilize it with the sperms. The sperms are
Hmm.
collected from the husband. The husband does a simple ejaculation and gives us the sperm. And these sperms are then taken. So if we take an egg in a dish and just put 1 lakh sperms on it, it's known as IVF. So the sperm has to do its own work, penetrate the egg and fertilize it in the dish instead of the fallopian tube of the girl. But the other technology is ICSI. So there's a machine called the micro manipulator, and we take one egg, one sperm in a needle, and inject it straight into the egg. And that is known as ICSI, and that is especially good for where the male factor is there, or tuberculosis is there, or endometriosis is there, or there are less eggs. We prefer to do ICSI. And these are the two technologies which actually bring about the fertilization. That means creation of the baby outside the
Hmm.
body. Then these eggs, which are injected with sperms, are kept in the incubator.
Hmm.
Incubators, like our bodies, the temperatures, the maintained, the pH, everything is just like the body. It's like the womb. And after 2 days or 3 days, we pick up these babies which are there, like a day two babe old embryo, or a day three old embryo, or a day five old embryo, and we put it delicately back into the womb. That is known as embryo transfer. And that is the whole process of IVF. And after 10 to 12 days, we can do a blood test or even a urine pregnancy test today, can diagnose whether the patient is pregnant or not. And if you're pregnant, we obviously support the pregnancy with hormones, right up to, say, 2.5 to 3 months, and then it becomes like a normal pregnancy. For 2 to 3 months, you have to take medicines which we give you.
Hmm. This is like a very fascinating process, and thank you for simplifying it and explaining so well for the audience members. But clearly, this is not something that happens, in a day. It's a process that takes time, which brings me to my next question: that how long does IVF take to get somebody pregnant? And this is a question that so many people have asked on this forum. So we've also come across it so much in our research that it's it has to be, I guess, answered.
See, normal, say one cycle of IVF is about 15 days, where we
Hmm.
collect the embryos and we take them. A lot of times we don't put the embryos back in, we cryopreserve them. Freezing of the embryos is done. And in the next cycle, the uterus is prepared and the embryos are put back inside. So, in that process, it takes about 1.5 months. But if we don't cryopreserve the embryos, it takes about a month. But what here I would like to say is every time we do a process, it is about 50% pregnancy rate, or even 60% in younger patients who have good ovarian reserve, who are younger than 35, a good AMH, sperm count is not very bad. So those success rates are definitely higher.
Hmm.
Whereas if a patient is above 40, the success rate drops. So it's a multiple attempt therapy. So in a good prognosis patient, if you do 3 to 4 attempts of just embryo transfer, I'm talking about, because a lot of times the patient produces about 10, I told you, you need about 12, you get about 10 to 12 eggs. So say
Hmm.
you produce 10 babies, then every time we put back 2 or 3 babies, so you get 3 attempts out of that. So in 3 to 4 attempts, you actually have a 90% live birth rate. Meaning sometimes there are abortions, sometimes there are problems with the pregnancy. So actually, in good prognosis patient, what are good prognosis patient? Meaning a patient who is young, under
Hmm.
35, who's got an AMH which is normal. Sperms are not very bad, like 1 million, 2 million, but they're above 5 million count. The
Hmm.
uterus is good. These are the patients who really have a good result. And the poor prognosis patients who have low, age, lower AMH, they have a 60% take home baby rate after about 5 to 6 attempts. So it's important to understand, not a one time treatment. You must, do a repeated attempt if you want
Hmm.
a pregnancy. And today, IVF has become very patient friendly. Like people who have, I have patients who are very scared of needles. They say, doctor. So when they come to me at Leelavati, I give them injections which are, like very micro doses.
Hmm.
So that injection shot is very, very less. So it's as, I can't say it's not painful, but it's as
Like a tip,
less
maybe.
painful as possible, because any kind of needle,
Yeah.
patient will definitely tell me, doc, what are you talking? But it is really, really like as thin as a hair, and the injection amount is also very low. So I
Hmm.
think that is the most painful
So,
part.
but really, I mean, for the even the injection to become the needle to become that thin, and for the pain to be sort of lesser than what it was before, progress has been made. And of course, this is not the only place where the progress has been made. We all know, like ICSI is something which maybe wasn't there 40 years ago when IVF started.
Yeah, ICSI
So,
started only in 1992. You're right.
hmm. So, another question that we get a lot is that how many attempts can a couple go for? Like, realistically, how many attempts not would take, but how many attempts are safe for a couple to try for?
Meena, this is a very, very good question. Fortunately, whatever research has shown till now, see, we are always worried about what is the effect of these drugs on the body, what is the
Hmm.
effect of IVF on the girl. And
Hmm.
fortunately, whatever research has been done so far, whatever reports have come and studies that have come, there have been no adverse effects on the on the girl. So I've had patients who have had 6 IVF cycles, 12 IVF cycles, and we've got them pregnant in the subsequent cycle. My case, which was maximum, was 26 IVF cycles, who had attempted 26 times, and then 27 times she came to me. She'd done it somewhere else, abroad. And then she came to me and she took home a baby. So I think it is. I would not advise so many, because by then, it's not easy. No, it's very tough. A woman has to be very tough to undergo so many IVF cycles. But then, so I think about 5 to 6 would be absolutely okay. But
Hmm.
there are a lot of patients who undergo 10 to 12 also cycles, and without any worry, you should not worry about it.
So there are no adverse effects of going in for multiple cycles. It's
No.
absolutely safe. So now that we're talking about, safety and these concerns, one of the questions that comes up a lot, and especially if you were to go and research about IVF on the internet, one question that stands up a lot, and which I would also like to point out maybe is a myth, is that do IVF babies have any disadvantages after they're born? Like, are there any problems that they're likely to face more than a baby who was born without IVF?
I think a lot of studies have been done, a lot of research has been done, and the milestones, etc., have been found to be the same. The only trouble that is there is when you have multiple pregnancy. When you have twins or triplets, fortunately, we don't see any quadruplets or quintuplets now. Those are actually because of the tablets, not because of IVF, because nobody really puts in that many babies when you put back. When you do IVF. So the twins and the triplets, the problems arise because there is obstetric complication, that is premature
Mm,
delivery. Then
mm,
the chance of developing blood pressure, gestational diabetes, or small for birth, small for gestation babies, as we call it. It's a very medical term, but the babies are smaller than what should normally be. Now, these babies face problems. So I don't think there is much of a disadvantage as such, except that you have to these patients are the ones who have complications. That's why they're not conceiving. See, a lot of
mm,
patient girls have polycystic ovary. Now, having
mm,
polycystic ovary itself can give you a higher risk of hypertension and diabetes during pregnancy. Now, those can cause problems during pregnancy. So
mm,
then older age group, older age group, again, there are complication rates are higher. So those can cause problems in the baby being smaller. The birth weight can be smaller, etc., etc. So these are some of the problems that we do see in IVF pregnancies.
It's not IVF in itself, it's rather the nature of the case, which is could be
Yes,
PCOD,
yes,
advanced, and so on and so forth.
yeah.
Another question that comes up a lot is that are there any long-term side effects of IVF?
Fortunately, we've not really seen
Hmm,
too many. So, if abnormalities in the children, like if you
hmm,
conceive naturally, it's about
hmm,
2%,
hmm,
and with IVF, it's about 3%, so it's an acceptable increase.
hmm,
And that is something that's why anyway we monitor pregnancies very closely. So nowadays even genetic tests are available, pre-implantation, and also genetic tests can be done during your pregnancy. So in fact,
hmm,
that is something that I think all mothers should be aware of, that you can do the genetics of your baby before putting the baby inside, or you can do the genetics of the baby once you're pregnant. And it does
hmm,
not involve taking blood from your baby. It just involves taking blood from the mother. And the
hmm,
technology is so advanced that we can identify the fetal chromosomes from the mother's blood, and
hmm,
actually sequence them and give a report that the fetus has these problems or the fetus is normal. So I
hmm,
think technology has really been a wonderful tool in medicine, and it has helped us progress a lot.
hmm. But are there any long-term effects of the procedure on women? Because you hear a lot of things about how in the long term, and this is of course hearsay, there may or may not be research, but about how in the long term, it can give you cancer or it could give you other health problems. Is there any truth to it for women involved?
See, cancer has been studied extensively. As I
Hmm.
said before, also, being infertile increases your risk of cancer. But the
Hmm.
drugs have not shown any thing leading to cancer. So,
Hmm.
but per se, being infertile can increase your risk of certain cancers.
So again, it's not the procedure, but rather the case that you present with.
Yeah.
Okay. There is another very fascinating question, which really, I mean, I don't know what your response to it is going to be. But one thing which has been asked over and over again is that can IVF cause mental illness in both the children and, the woman who's going to be bearing the IVF child? I think we know the answer, but still.
No, no, no. It's the question is, mental illness. What happens is being infertile. There's a lot of depression and all.
Hmm.
That kind of mental illness I definitely see in a lot of patients. They don't have a child and they definitely start getting depressed, the women, the men also. It's not
Hmm.
only a woman oriented illness. So
Hmm.
counseling is very important, keeping their spirits up, chatting with them, the supportive environment of around them, if their family is supportive or not, if the society is supportive or not. And then, of course, girls are working in office. Sometimes they don't want to disclose. And then the boss is getting irritated that they're taking offs, to do certain things which they're not disclosing. Now, see, I feel better if things are disclosed. But then again, it's a personal choice. So all
Hmm.
this causes a lot of stress.
Hmm.
So mental illness in that form can happen.
Hmm.
And on the children, as such, it is not shown that there is any increase in any kind of mental illness directly as
Hmm.
such. So, no, it can just happen.
It
I mean,
can.
we don't know why mental illnesses happen in people, but they happen. So, the IVF babies are no different. They are like normal babies. So, if it has to happen, it will happen.
But it is clear, like, in the conversation that we've just had and the points that we've discussed before this, it's clear that a lot of pre existing things that may lead a couple to visit an IVF doctor and undergo IVF or any other fertility treatment does sort of can cause rather some kind of problems, and be it a whole lot of stress, the infertility that may come from certain problems may lead to hypertension, heart disease, cancer. So that fertility in itself is a bed of problems, and the IVF is rather just the solution to having a child.
I wish it was as simple as that. But you know what? Hypertension, diabetes, and all doesn't happen so commonly in this age group
Hmm.
which I treat. Okay,
Hmm.
a few people do have, the men especially do develop hypertension
Hmm.
because of their work and stuff like that.
Hmm.
Okay,
Hmm.
and the women who are a little obese, now there's a pandemic of obesity, 30% of our population is obese. So that obesity can cause problems also. So yeah, these things by itself, the obesity causes depression also. Then
Hmm.
the PCOS causes a lot of facial acne, hirsutism, that causes mental disturbances, along with the obesity. So all these things really put together and along with the infertility
Hmm.
can be difficult to deal with.
Yeah. So, if we can just sort of move away from this line of thought and talk about something which I'm sure you've also heard about a lot, and we know is a genuine concern for couples who are going in for IVF, which is the cost. A lot of people want to know that what is the average cost of an IVF cycle in India?
So, see, the cost all depends on the technologies that you use, what are the things that we are offering, etc., etc. So, yeah, the cost can be anything from 50,000 to 1.5 lakh to 2 lakhs. I mean, it can really vary. And there are
mm,
many centers which are offering very low cost budget IVFs. Then there
mm,
are many centers which are offering even artificial intelligence along with their IVF cycles. Now
mm.
remember, when you're offering a lot of technology, and it's difficult to cut costs
Yeah,
beyond a point. So
yeah.
I think one needs to understand that yes, there will be limitations in cost cutting. So yes, you
Mm,
can get IVF cycles from 50,000 to 2 lakh also. Now, if there's genetic testing, the cost
mm,
escalates.
mm.
So this is what it is all about.
So the more things that are, let's say, added to a cycle, the cost
If
will
it's
go up,
needed,
like genetic
if it's
testing.
needed.
If it's needed. Okay. All right. So, I'm in your extensive experience, what are some of the most common questions that you've been asked? Could you share some of them with us?
I think I must tell you the story just to lighten the atmosphere. One couple came to me, and they were a young couple, just married and all,
Mm,
and she had blocked tubes. You know, so they came and showed me the reports. So I said, "आपको test tube baby की ज़रूरत है, आपको बच्चा test tube baby से ही होगा." तो both of them started looking at me very perplexed, कि अब क्या कह रहे हो आप, ऐसे कैसे, and all that. एंड देन दे आस्क्ड मी, लेकिन डॉक्टर वो तो ठीक है, हम तैयार है, बट हम टेस्ट ट्यूब के अंदर कैसे जाएंगे दोनों? So these things do happen, and it's a fun thing. So basically, the most of the people worried are that what you asked me, are the
mm,
test tube babies normal? Then
mm,
are the sperms going to be mine? Are the eggs going to be mine? Are you going to use other people's sperms? So I think what everybody needs to understand is that test tube baby खुद के अंडे और खुद के sperm से ही किया जाता है. We use your eggs, your sperms.
mm,
Of course, when you give us permission, like I had a patient the other day who did not want to undergo, biopsy. Like we are experts at doing zero sperms. When
mm,
the husband has zero sperms, we go into the biopsy and we take the sperms from the testes. So
mm,
it's a surgical procedure where we make a cut on the testes and we remove the sperms from there. So this husband didn't want to do it, so he gave us permission to use donor sperms. So
mm,
unless we have your permission, we will not do it. So it is your eggs, your sperms
mm.
always. So that is one question. The other question that everybody tells us, doctor, I'm sending a friend, but don't tell her I had IVF. Okay, my baby was not IVF; it was a
Yeah,
natural conception. So I think that social stigma is still there
yeah,
about IVF. So, which is what we understand. And probably, Meghna, if I was a heart surgeon and I'd operated, my patient would go and say, "Oh, Dr. Nandita did such a
yeah,
fantastic operation, and I'm so fine." But in this field, it is all hush hush. So, because
yeah.
people don't like to disclose, that they've done the IVF, but things are changing. Things are definitely changing. And people do send people, and I think the younger generation is definitely helping out its peers. So
Mm,
if one girl becomes pregnant, my as I keep saying, my one baby sends me about 100 babies more.
yeah.
By word of mouth, they definitely refer patients. So I think that makes a lot of difference. And as you said, injection से कुछ side effect होता है क्या? I think Meghna, you have covered most of the questions. So that's really nice. I can't think of anything other than that.
So, while I was doing my research, I came across a very interesting question, which was that do IVF babies look like their parents? And that really like confused me that where would that question come from? And now that you're talking about how people assume that, it'll be somebody else's egg and somebody else's sperm,
Yes,
so you sort of
yes.
connect the
Yeah,
dots.
yeah. That is what it is. So people should not worry about it unless
Yeah.
they tell the doctor. I don't
Mm.
think the doctor will, use other
Yeah.
sperms or other eggs.
Yeah. So, ma'am, as we come to the end of our program, I just wanted to sort of ask you to share your advice to all the couples watching who might be trying to get pregnant right now and may not have had that much luck.
I think My advice to youngsters would be that it's very, very important to do things at the right time.
Mm,
Okay. I know that some of you are struggling with it, but I think there is a simple test called the AMH for the girls. You do a serum AMH. I am seeing young girls, 26, 28 year olds, with decreased ovarian reserve, that is accelerated aging in Indian girls,
mm,
probably due to pollution, due to stress, due to autoimmunity, etc. So we are freezing eggs. I'm freezing eggs of young girls. Like one of my patients, Miss Diana Hayden, Miss World, she was Miss World. She froze her eggs when she was 33 and had her babies when she was 40. So
mm,
it is a great way of protecting your biological clock. So, a lot of girls who have not had a opportunity to meet the right guy, or they're busy in their career, should opt for this. It's very empowering because it gives them the freedom to do, to select, wait for the right Mr. Right,
yeah.
to have their careers. Those who are married and want to postpone their childbearing, they can actually freeze their embryos and keep them. We can freeze embryos for 5 years. I've had a
Mm,
young girl who's come and frozen eggs today. So these technologies are there to help you. And those
mm,
who are undergoing the treatment and have not been successful, remember that there is a chain in America which says
mm,
6 cycles of money back. Why? Because when we take 10 patients, 6 cycles ka money, only one or two patients we have to give the money back. 8 patients conceive. So the whole
mm,
concept is repeated treatments will help you. Once you paid the money, you will do the treatment, right?
yeah.
So repeated treatment is very, very important. I over the years, over the last 30 years, I have seen pregnancy rates from, I remember in the 90s, it started with like horrendous pregnancy rates of 10, 15%, to
Mhm.
today it's
Wow.
like 50, 60%.
Yeah.
So I think it is very much necessary that you stick to the treatment. You're lucky this generation. Louisa Brown, the first baby which was born, there were thousands of attempts before she was born. So her success rate was 1%. I mean,
Yeah.
we look where we've come. So
Yeah.
technology is there, and we've got fantastic technology now. We're even doing non-invasive genetics without touching the baby. People are scared. You'll biopsy the baby. Will you cause any damage? Now we have a technology which is non-invasive also. We do not
Yeah.
touch that child at all. We just take the fluid in which it's growing. So these technologies are available. Then the time-lapse photography, which you have in your mobile, no? We
Yeah.
do photography of the baby, and that growth
Oh.
pattern tells us that this is a very good embryo which will give us a good pregnancy rate. So all these technologies for the male factor, though, there is so much advanced. The microfluidics, the magnetic activated the
Mm,
screening,
mm,
all those technologies are used to get the perfect sperm. So I think technology is here because a lot of people waste time on natural, natural, natural. I want to do natural. I want to do natural. What you need to understand is we are also very happy with natural. But there is a point where you have to draw a line. I will do natural for 6 months, for 1 year.
mm,
But watch the AMH, watch the age of the girl,
mm,
and accordingly decide how much time you have or you don't have. I think that is a very important message that I must to give you, that use the technologies which are available to you, because
mm.
as Abdul Kalam has said, technology actually has been a boon to the field of medicine. And really in IVF, technology has taken it like it's the success rates have skyrocketed upwards only. Absolutely.
I think that makes absolute sense. And thank you so much for, talking to us today. This was a really lovely session. And thank you for sharing your insights. I know that the couples watching this have, gone home richer because they know now things that they may not have known before. Thank you so much, Dr. Nandita. It was a pleasure having you here.
Thank you, Meghna. Thank you so much. It was fun chatting with you.
Same, ma'am. Thank you. Have a nice day.
Thank you.